My name is Gabriella Falls. First, I will begin with the drug knowledge using my drug knowledge sheet. I will begin with the classification for acetaminophen, and it is an analgesic or antipyretic, and it is used to treat pain or fever. I will then note the onset, peak, and duration for the medication. The onset is 30 minutes to an hour. The peak is 1 to 3 hours, and the duration is 3 to 8 hours, just depending on the dose given. I'll then note any adverse reactions or side effects that may occur with this medication, such as headache, fatigue, constipation, nausea, vomiting, and rashes. And this will be used when figuring out any contraindications for my patient. I'll then note that there is a medication policy that is unique per hospital. And then I will begin by signing the signature sheet, and this only needs to be done once. So the date is August 7th, 2020. Full name is Gabriella Falls. My status is SPN 1, which means Student Practical Nurse 1. I will sign and initial the sheet. I will then go to the doctor's orders and use the MAR just to check before beginning. So I note that my patient's name is Sid Garland. His MRN number is 344316. His date of birth is November 8th, 1965. He has allergies to penicillin and codeine. The drug being administered today is acetaminophen or Tylenol, which is acetaminophen or Tylenol. The dose is 650 milligrams. I also note that the route will be PO, here it says PO, and that the frequency will be every 4 to 6 hours as needed, and the frequency here says 4 to 6 hours. I'll also note the time it is to be administered. The doctor has ordered for it to be 1800 hours, and I note here in the MAR that the dose for 1800 hours has not been given yet. And I also note any special directions or instructions, and on the MAR it states that the medication cannot exceed 4 grams per day, and it must only be given for 4 days. So everything checks out. At this time I will use my worksheet and write down any pertinent information. So my patient's name is Sid Garland, and his date of birth is November 8, 1965. His MRN number is 344316. He is allergic to penicillin and codeine. And then I'll write down any further information about his the reason why he was admitted, as well as the fact that he is an 86-year-old male. He was admitted for a below the knee amputation due to the fact that he has suffered from a gangrenous foot ulcer for the past year. I'll also note any past medical history. He has asthma, hypertension, type 2 diabetes, and he had a myocardial infarction 2 years ago. I'll also note that he is 2 days post-op, and this med will be given for mild post-operative pain. All right. I will then note that I have pre-assessed my patient. I've checked my patient's pain score as well as their vital signs and any lab values that may have been taken to ensure that there are no contraindications to giving this medication, as well as that this patient still needs the medication based on the pain score that they state, which they still do. I'll also check in this pre-assessment that the patient is able to swallow, as it is important when noting that they are being given a medication by mouth that their swallowing is intact, and it is. All right. Okay, I will then perform hand hygiene, and I'll take out the medication, checking the expiry date, and it expires August 2025, so it is still good to use. I will then begin the first check on the MAR. So taking the medication, I will begin using the 8 rights. So the patient's name is Sid Garland. Sid Garland. The drug being used today is acetaminophen. The dose is 650 milligrams. Here I have 325 milligrams per tablet, so I will need to do a calculation. I will then note that the route is PO. So I know that these are tablets, so they can be taken PO. And the site will be by mouth. And I know that tablets are able to go by mouth. I will then note the frequency, which is every 4 to 6 hours. And I know that acetaminophen can be given every 4 to 6 hours. I will also note the time that this medication is to be given at 1800 hours, and I note that there has not been any documentation that's been given, so this will be given at 1800 hours. I will also note that this is going to be given for mild postoperative pain, and I know that acetaminophen will cure any pain since it is an analgesic. At this point, I will then perform my second check, going back again to say that the patient's name is Sid Garland. Sid Garland. The drug being administered today is acetaminophen. The dose is 650 milligrams. Here I have 325 milligrams, which means I will need to do a calculation. The route will be PO, and I know that these are tablets, so they can be given PO. The site will be by mouth, and I know that tablets are able to go by mouth. The frequency will be every 4 to 6 hours, and I know that this medication can be given every 4 to 6 hours safely. I'll also note that the time is 1800 hours, and that this medication has not been given yet for 1800 hours. I'll then note that this pain is also going to be given for mild postoperative, this medication will be used for mild postoperative pain, and I know that acetaminophen is an analgesic, so it will take care of any pain. At this time, since these tablets do not equal the dose being given, I will perform a calculation on my worksheet using the formula D over A times Q. So D will be the desired amount, or the order from the doctor, which is 650 milligrams, divided by the amount that we have here. So the amount available is 325 milligrams, multiplied by 1 tablet, because these are in tablet form. I'll then use my calculator. 650 divided by 325 times 1, and I get 2, which means that I will be needing 2 tablets for my patient. I will then maintain asepsis and pour 2 tablets into the cap. Oh, I got 3. There we go. And I'll place this into my medication cup. At this time, I will do my second check. My third check. So my patient's name is Sid Garland. Sid Garland. The drug being administered is acetaminophen. The dose will be 650 milligrams. I only have 325 milligram tablets here, but I have done a calculation and figured out that I do need 2 tablets today. The route will be PO. I know that these are tablets, so they can be given PO. The site will be by mouth, and I know that tablets are able to be given by mouth. The frequency will be every 4 to 6 hours, and I know that acetaminophen is safe to be given every 4 to 6 hours. I'll note the time, and it is to be given at the 1800 hour time, and I know that acetaminophen has not been given at this time yet because it has not been documented. And I also note the reason is for mild postoperative pain, and I know that acetaminophen is an analgesic, so that it will help with pain. At this time, I will turn over my worksheet, and I will perform the second calculation to make sure that this is indeed the amount that I need. So it'll be D over A times Q. So the desired amount is 650 milligrams ordered by the doctor, over the amount available, which is 325 milligrams, multiplied by 1 tablet, which then equals times 1 equals 2. So after checking twice with both calculations, I have confirmed that I do need 2 tablets. So at this time, sorry, I'll leave this out. I'll get my teacher to come and check that I have done the proper calculations, and I have. So then I will put my worksheet in my pocket, clean up the nurse's station, the med cart, put away the medication, and I will then perform hand hygiene before going into my patient's room. I'll let the patient know I'm coming in, and then I will introduce myself. Hi, my name is Gabriella Falls. I'm a student nurse at Durham College, and I'm here to administer your medication today for your mild post-op pain. Is that okay with you? The patient will consent that it is okay, and then I'll do a quick environmental check to make sure that everything is in order, such as the oxygen, the suctioning, the bed rails, the brakes, etc. Everything is okay. So then at this time, I will identify my patient with my worksheet. I'll ask the patient to verbalize his name and his date of birth while checking his wristband to make sure that it does match my worksheet. So his name is Sid Garland. His date of birth is November 8th, 1965, which both check out. And I would also note his MRN number at this time, which is 344316, and it does check out. I would also notice that the patient does have a red armband on, which means that they do have allergies, and I see that they are allergic to penicillin and codeine, which also matches with what I have on my worksheet. At this time, I would then ask the patient about any allergies they have, and they would verbalize that they are allergic to penicillin and codeine. And in this case, I would ask them what reactions they may have to these allergens. So they may have something like a rash, or they may experience nausea or vomiting or tightness when they're breathing. So it's important to know and let them know that there is no penicillin or codeine present in the medication being given today. I will then also perform a health teaching to the patient to let them know that acetaminophen may cause constipation. So I will be administering the medication to them today with a large glass of water, but it is important to make sure that their fluid intake is still high, and also maybe having a higher fiber intake, as well as stool softeners can be ordered in case to help with constipation. I'll also let the patient know that a rash is also an adverse side effect of this medication. So if that does occur, to let the nurse or the healthcare professional know, and we will take care of it from there. So those will be the two health teachings that I would let the patient know. At this time, I would position the patient in an upright position. I would give them a large glass of water, and I would administer the medication, making sure that they fully swallow the medication and that the medication is not left in their mouth when I check. I would then return the patient to a comfortable position upon administration and make sure that they're safe, comfortable, and that the call bell is in place in case they need to use it. I would then leave the room, and I would go straight to the MAR to document that I did provide the patient with the 1800-hour med, and I would initial my name, leaving room for a cosign by my teacher. And I would also document that the medication was given PO, as it is able to be given by rectum, which is PR or PO. So I need to make sure that I document the way it was given. At this time, my teacher would come in and cosign for me. And then I would return to the room in about 30 minutes for a post-assessment to make sure that the patient is feeling some relief from their post-operative pain. And that completes my medication administration.